I'm Brittany. I'm going to discuss first an article from CNN about the opioid epidemic in the country. It is regarding President Trump on Wednesday this week signed legislation to help fight the opioid epidemic. The legislation is supposed to bring $6 billion in funding to the opioid epidemic, and it was passed really with very little opposition. It passed in the Senate with 98 to 1 vote and in the House with 393 to 8. Some of the things that the legislation is going to do, it is going to expand and reauthorize various programs that we have had before and offer new programs as well. It is going to help prevent doctor shopping by improving state prescription drug monitoring. It's offering services to pregnant mothers who are in opioid addiction and they're withdrawing babies, which is something we see a lot in the Children's Hospital and the NICU especially. It also has a measure for the U.S. Postal Service and how those drugs are getting into the country and how they're supposed to screen from them coming in overseas. One of the goals of the legislation is also to find new, less addictive drugs for pain management and to expand treatment to those who are addicted. This all started a year ago when the Trump administration declared opioid addiction a public health emergency. More than 72,000 Americans died from drug overdoses in 2017, which was up 7%. Half of those more than half, 49,000 of those deaths were from opioids. Some of the reaction that the legislation is getting from experts in the field is really just mostly positive, but kind of hesitant as well. It just depends on how the bill is enacted. And one of the experts, Lee, in the article was quoted as saying, "A national public health emergency warrants a public health approach, which should center squarely on prevention and particularly primary prevention." So if you're just trying to treat the addictions, it may not be as successful of a bill as they would like. It needs to fundamentally take care of pain and addiction as the chronic disorders that they are, is what was discussed in this article. I think that the nursing implications of this legislation are going to be varied and hopefully are going to be pretty vast. I think that we'll see an increase in the need for addiction specialists and nurses in those fields as well, hopefully, to help treat those that are addicted. So the next thing I'm going to discuss is my teaching plan and what I was teaching about in my handout. My teaching is about managing pediatric pain in the hospital setting. It's something we see frequently. Children come in and they have to have procedures done and many times are anxious and in pain, and parents don't really know how to help with that. And parents are our biggest asset if they were educated correctly in helping us when we're doing things like starting an IV or drawing labs. They could really be helpful, but many times they aren't capable of being helpful because they don't have the education to do so. So the target audience of this handout is parents of pediatric patients in the acute care setting. Patients in the population may experience events that are perceived as scary or painful, and parents really could be helpful with that. So the target time for this handout is designed to be given to parents on arrival at the emergency department, at admissions, whenever you have a moment to teach them and let them see the handout and go over some of the things that they could be helping with and how to approach their children's pain. At the end of this presentation, the patient or family caregiver will be able to identify and perform non-pharmaceutical approaches to procedural pain experienced in the pediatric acute care setting. So specific learning objectives for the cognitive domain, parent and caregiver will list 3 methods of pain relief in pediatric patients by the end of education. Parent or caregiver will state 3 indicators of pediatric pain by the end of education. In the affective domain, the goals are going to be that the parent or caregiver will accept written information about pediatric pain, and parent or caregiver will observe nurse utilizing at least 2 pain relief methods during teaching. So you can demonstrate to them things that they can do. Psychomotor, parent or caregiver will demonstrate 2 methods of pediatric pain relief by the end of the presentation, and parent or caregiver will utilize at least 1 strategy for pain relief in response to pain indicators or expected pain over the course of the hospitalization. Evaluation techniques for cognitive goals. Learning will have occurred if the parent is able to identify indicators of pediatric pain and methods to alleviate that pain. Effective goals will be achieved when learning has occurred. Learning will have occurred if parent or caregiver accepts learning material and observes nurse performing pain relief methods. And cognitive goals. Nurse will know that learning has occurred when parent or caregiver is capable of performing a return demonstration of at least 2 methods of procedural pain management. So I made a brochure, and it's just about, it has different information in it about pain management in pediatrics. So the opening page just says all patients have a right to adequate pain relief while in the hospital. Something that we just want every parent to know, that we're going to do everything we can to treat their patient's pain while they're with us. So you open it up, and here's the first page. It's called Pain in Your Child. So this says, while in the hospital, your child may need procedures that cause pain or anxiety. Many of these procedures are quick and only cause brief pain. These types of procedures are not treated with pain medication. While in the hospital, you can help your child with mild pain that is not treated with pain medication. Some procedures cause anxiety, fear, or pain in children. Some of the procedures your child may need while in the hospital that cause brief pain or anxiety are placement of IV lines, obtaining blood samples, placing a tube in your child's nose or mouth. And of course, we know that's not all of the things that can be encompassed, but those are some of the pretty basic things we do that children have fear and pain with. So the next in the center just has a little bit of information here at the top, and then signs of pain here at the bottom. The top says, use the techniques in this brochure to help manage your child's pain, fear, or anxiety while they are in the hospital. Please discuss any concerns about pain relief with your child's healthcare team as soon as possible. Signs of pain. Every child will react differently to pain, but there are some signs to watch for that may mean your child is in pain. Understanding when your child is in pain is important in treating their pain. Some signs of pain may include crying, a grimace or sad face, restlessness, changes in breathing such as breath holding or breathing faster, grabbing at the painful site, and the child may also state that they hurt or in pain if they're old enough. And then the third page on this brochure is just beginning to talk about pain relief techniques and some of the things that you can do for your child while they're in the hospital. Pain relief techniques. There are many different methods of pain relief that do not involve medication. Following are common methods that are easy to use while you're in the hospital. The first method is distraction. Distraction is a simple and effective tool to manage pediatric pain. Distraction is performed simply by taking your child's mind off of the pain being experienced. This can be as simple as allowing the child to watch a movie while nurses are obtaining blood samples. Keeping your child actively engaged in distraction is important. For example, if a television show is being used as a distraction, ask your child about their favorite character on the show or something that's happening while they're watching it. Any safe activity that your child enjoys can be used as a distraction. Some examples of distraction include creative play such as dolls, stuffed animals, or Legos, reading, art, or the television. Relaxation is another great method for treating mild pain. If your child is relaxed, anxiety and stress are reduced, further reducing pain in your child as well. Some ways to promote relaxation for your child include lowering the lights, playing soft music, and deep breathing. Bubbles can be used for deep breathing. They can be helpful for that as well. And then just any sort of soft music. We play a lot of lullabies at night for our patients. It just kind of helps them calm down and relax and not have as much anxiety. And then we have this back page, which is some more pain relief techniques. There's a total of 4 discussed in this brochure. Comforting touch. Touch is an important sense for children and can provide comfort, relaxation, and pain relief. Comforting touch can be as simple as a hug or snuggle for your child. Simple massage is also helpful for pain relief, and rocking can be very soothing for children, especially infants. Actually, in the Kentucky Children's Hospital in the NICU, they have a nurse that goes around and does massages. That's what they do for their babies with little massage oils, and they're scheduled, and it's helpful for their pain and relaxation, which was something I learned when I started working there. Controlled breathing is the last technique discussed in this brochure. Controlled breathing is an effective pain relief method. One simple and fun way to achieve controlled breathing with your child is to blow bubbles. Blowing a pinwheel is also a way to perform controlled breathing with your child. Provide prompts to take slow, even breaths to move the pinwheels or to make bubbles. These methods combine controlled breathing and distraction. Older children can be prompted to take cleansing breaths. Have your child breathe in through their nose slowly, followed by slowly breathing out through their mouth. All of these things that are discussed in the brochure are things that Child Life can provide for you while you're in our hospital. We have a Child Life specialist. They can bring bubbles, they can bring pinwheels, Legos, coloring books, pretty much anything. We have tons of movies that children can pick from. We have like a movie menu. It's just printed all of the movies that we have, and they can check off what they want us to bring to them. We have rolling Xboxes and rolling Wiis, rolling televisions that we bring in just to get the children's mind off of whatever is going on during their hospitalization. Try to make it as least traumatic as possible. And then the back page is simply references. There's also a picture on this page that shows the child. She can be distracted with the stuffed animal. Her pain seems adequately controlled at this moment. And then on this page is also a picture of a child that is painting, which is another good distraction method, although it can be messy. I think that that's one of the best ways in children to use non-pharmacological pain management is just techniques that don't involve needing to do anything. You can do them all in your bed. You can use distraction in your bed. You can use deep breathing, controlled breathing. That can all just be done in the bed with parent through some simple prompts. So, thank you.